Welcome back. Well, that winter sickness is among us, which leaves us with those common questions. How can we avoid getting sick? And if we catch something, how do we treat it? And here with all the answers is CHRISTUS Trinity Mother Francis Pamela Mackay. How are you, Pamela?
I'm good. How are y'all?
Great. Thank you so much for joining us.
Yes, on behalf of CHRISTUS Trinity Mother Francis, thanks for having me.
Yes. So it's winter, and I feel like sickness, you know, all those illnesses are just flying around in the air. So what are kind of the common illnesses that we see at this time?
Well, there are a lot of illnesses right now, and two of the most common ones are, of course, strep throat caused by the Streptococcus bacteria and the flu virus. We're seeing a lot of patients come in with those two viruses. They're contracted through sneezing or coughing, so it's very important to cover your mouth and nose when you do that, or by sharing utensils and drinks.
Wow, very important. How can people prevent from getting sick?
Well, like I said, definitely cover your mouth and nose with your arm if you're sneezing or coughing. And another way is to practice good health hygiene. That's washing your hands frequently and thoroughly with soap and water. Do that often. I mean, it spreads very fast in the schools and daycares. And another prevention, of course, with strep throat, there's no vaccine, but with the flu, there is a vaccine. We urge everyone in the community to get this, especially if you're a high-risk patient. High-risk patients are children and infants, pregnant women, and people over the age of 65 who are more susceptible to illness.
And I don't know if this article was completely correct, but I read that door handles and kind of the handles in your sink are really, like, they spread germs pretty fast.
Bacteria and virus can live on these surfaces, so that's why we say wash your hands often.
Wash your hands.
You might not be able to avoid getting those bacteria on your hands, but if you wash your hands, you won't contract the illness.
What are your thoughts about hand sanitizer and using that as a method to constantly wash your hands?
You can use that, definitely use it, but if your hands are grimy or if you have used it over and over, you need to wash your hands with soap and water.
Washing your hands is better. Okay. And so how can you know, what are the symptoms for knowing that you're sick?
Well, there's some common symptoms between the two illnesses, fever, fatigue, muscle aches. You see those with both strep and the flu. With strep, you might also see headaches, which many people don't realize. You'll have, of course, the sore throat, problem swallowing. So if you have either of those or swollen lymph nodes, you need to seek treatment. Also with the flu, you might see more of cold type symptoms, congestion, runny nose, and that kind of stuff.
Now, what about a virus? How long does it take for a virus to actually spread, and how long can it stick around?
It spreads very quickly within contact. You might not see symptoms for a few days, but right when you see those symptoms, you need to get in with a healthcare provider. And it can stick around for a long time.
So from when you're diagnosed with a virus, it can last maybe up to 10 days, or does it just depend?
It depends on the severity of the illness, but it can last several weeks.
And when is it imperative to actually come to the doctor?
As soon as you notice these symptoms, you need to come to the doctor. Some people might not have fever, so don't rely on having fever to seek treatment. At CHRISTUS, we definitely are improving our access to care. So we try to see patients with these symptoms the same day so that they can get early treatment.
And so overall with winter sickness, what are those main tips that you would give people?
Well, prevention is the key. You practice a good hand hygiene. Go get the flu vaccine if you haven't already gotten it. It is still available at all CHRISTUS clinics right now. And then, you want to seek treatment early. So as soon as you get these symptoms, you need to come in. With the flu virus, they're both easily treated. So with the strep throat, we treat it with antibiotic therapy. So the sooner you start the antibiotics, the sooner you'll start to feel better and the less severe the illness will be. And with the flu, of course, we treat it with the antiviral. We prefer to start that antiviral within 2 days of onset of symptoms. So just try to get in as early as you can. This also prevents transmitting the virus or the bacteria to other individuals.
Great. Well, Pamela, thank you so much for joining us this morning.
Very
Great
insightful.
information there. All right, coming up next.